We're at USA MedBed. We're looking at the Progressa Hospital bed, and the Progressa Hospital bed came with two different types of air surfaces. And one is referred to as Pulmonary, which you can see right here. We've done many videos on that. And the other one is referred to as a therapy surface. So we're just going to do a real quick video to talk about the difference between those two surfaces. And we still actually have Total Care Sports back there in the corner, but this is really just a real quick video. When it comes to both of the different versions of the Progressa, the frame of the bed is going to be exactly the same. So you're going to have, you can see they're both in a chair position. You can stand in front of somebody, grab their hand, help lift them up. They can sit down in a chair, go back fully in. And that feature and all those features with the frame are going to be exactly the same. The difference, the main difference, is that the blue mattress is basically just low air loss. It does not have the rotation and it does not have the percussion vibration. So it's another version of the Progressa bed, the P7500 Hill Rom, but it's just with what we call a therapy surface or a low air loss mattress. Now, for anybody that doesn't know what low air loss is, basically inside the bed or underneath the mattress cover, you have air bladders. And every one of those little air bladders has holes that release air. And that air gets released over the surface of the mattress. And basically what it does is it circulates over the surface of the mattress and it whisks away moisture to keep the skin dry. So if it's a situation where there's bed sores, pressure wounds, skin ulcers, the moisture buildup helps break the skin down. And so low air loss is a feature that runs over the surface of the mattress, which is there to keep the skin dry, prevent bed sores and pressure wounds, and in some cases help dry them up, because obviously they're going to have a lot of moisture around a wound area. Now, both the mattresses have what we call here a stay in place. I'm just going to put that down there. You can kind of see down at the bottom it says stay in place. And then on the treatment surface, it also says on this one here, stay in place. And basically what that means is that the way that the air bladders are designed, they prevent the person from sliding down in bed. So when it comes to, keeping people in bed and preventing them from sliding down, that is a feature that both the beds have. They also have a feature, reverse Trendelenburg and a boost, that's going to turn the feet and bring them up this way, so you can help slide the person back down using their own body weight. But when it comes to the different versions of the Progressa bed, that is going to be the main difference, is that you're going to see a pulmonary or percussion vibration and a rotation feature in the pulmonary surface. Rotation means it'll turn the person all night long. And with the treatment surface, you're going to see basically just the low air loss feature that's going to be the main feature for that bed. So we have them both in stock. Both would be considered ICU beds. ICU beds in a hospital are considered to be beds with an air mattress system, which is primarily designed to prevent bed sores, and also a scale. So any bed that technically has an air mattress and a scale would be classified as ICU. For anybody out there that's dealing with people that are buying beds for home care, the more time somebody spends in a hospital bed, the more likely they are to need an air mattress system. And I get calls every day from people that'll say, hey, my loved one, my mom, friend, brother, sister, they're only in bed like 12 or 14 hours a day. And then I'll ask them, are they up moving around? And all they're really doing is moving them out of bed and putting them in a wheelchair or in a sitting surface. So in all theoretical, calculations, really, you're still putting pressure on the areas, the tailbone areas, the sacrum, the areas that are going to be most likely to break down and get a bed sore. So if the person is not mobile, if they're not up moving around, circulating and getting, just movement through that area, and all they do is either sit in bed or lay down, they're technically in bed all day long. They're just, instead of sitting in the bed, they're sitting in a chair. So in looking at that, those are people that the primary thing for them would probably be an air mattress system. It doesn't have to be one of these. There's a lot of different ways we can configure air mattresses. We have the Centrella beds and other bed models in here that can have an air mattress put on them. But if you have somebody that's spending the primary amount of time in bed, they're going to probably need an air mattress surface. So this is a real quick overview. The difference between the Hill Rom P7500 Progressa bed with a pulmonary surface and the difference between one with a therapy surface. We have both in stock. Give us a call at 858-263-4894 for California, 804-495-0770 for Virginia, USA MedBed, Hospital Direct Medical, and www.thenumber1hospitalbeds. Go to our website for more information or give us a call.